Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide the Public Health Weekly Update for March 23rd, 2023. This week, I'm going to go back to what we were talking about the last time, which is what are the best steps we can take to live as healthy a life as possible. We've talked about cigarette smoking, obesity, sleep, exercise, alcohol, and 2 weeks ago, we started with, should I have a pet? And I admitted at that time that I am biased. I've had pets all my life. Wherever we've lived in the world, we've had dogs and cats, and even now we have 3 dogs and 1 cat. So I'm not completely impartial, but I want to at least address the issues. So last time we talked about what the health benefits are. Today I'm going to talk about what the health risks of having a pet. Now, I can't cover all the risks, but I want to highlight a few things. I want to talk a little bit about direct risks, indirect risks, economic risks, and societal risks. Direct risks include bites and scratches and falls. Indirect risks are diseases spread to us by the animals, our pets, either directly or through ticks and other insects. Economic risks and societal risks. Bites are a big deal. More than 4.5 million people are bitten by dogs each year, and more than 800,000 receive medical attention. At least half of those bitten are kids. And if you look at this chart, the 2 lines at the top here are boys and girls bitten by dogs. Down here are cats. But you can see that the vast majority of bites that result in visits are in the kids under 10. The rate of dog bites goes down, with males being slightly more likely to be bitten up until about the age of 40. Cats, on the other hand, the rate rises over time, with women slightly more likely than men to be bitten by a cat. About 1 in 5 people who are bitten by a dog require medical attention, and children are, of course, the most likely victims of dog bites and the most likely to have a severe bite. If you look here, this darker area here is a bite on the face or neck. And of course, little kids, being at the level of a dog, are more likely to get bitten in the face. So this is under 5 dogs and cats, 5 to 9 dogs and cats, 10 to 24 dogs and cats. And what you can see is that for dogs and cats, the risk of being bitten on the face goes down dramatically with time. And that's why most severe bites are for kids, because that's where most of the damage can be done. Most dog bites affecting young children occur during everyday activities while interacting with familiar dogs. The vast majority of bites of children are by dogs that they know. And according to at least one report, the majority of bites are provoked in some way. So how do you avoid dog bites? Well, according to the CDC, don't approach unfamiliar animals, no matter how friendly they look. If the animal's with their owner, ask before you reach out to it. Pay attention to body language. Look for clues that the pet is scared, hurt, defensive. Don't play rough with pets or encourage biting. Of course, that's what that picture shows me doing when I was younger. Don't disturb animals when they're eating, sleeping, or caring for their babies. Don't kiss or hold small animals near your face. Make sure the animal can see you before you touch it, and always, always supervise children when they're around animals, and teach kids how to properly interact with animals. If you are bitten, the CDC says wash the wound with warm, soapy water right away. If it's just a minor wound, a scratch, you can cover it with a clean bandage. But for deeper wounds, apply pressure until the bleeding stops, and then get medical care if you have a deep wound or any wound in a part of the body where scarring would be aesthetically unpleasing. Also, get medical care if you don't know whether the animal's vaccinated against rabies, if it's a wild animal, or if it's been more than 5 years since your last tetanus shot. Another area that we don't talk a lot about is falls risks, but it's surprisingly common. There are over 85,000 fall injuries every year associated with pets. The vast majority are dogs. And interestingly, it's walking dogs and chasing pets that are associated with the greatest risk of injuries. I always thought it was little dogs that you trip over because you didn't see them, but little dogs are pretty good at avoiding getting tripped over. Falls-related injuries are more common in the elderly, but they occur in all age groups. And the CDC suggests that we just need to raise the awareness of people that it's often walking dogs or chasing dogs when they're off the leash that can cause fall injuries. And of course, they stress the importance of obedience training. In terms of infectious diseases, we can't cover all of them. The CDC lists over 100 diseases that can spread between animals and humans. Cat scratch fever, E. coli or bacterial diseases. You can get fungal diseases. Of course, you get salmonella from reptiles and other such beasts. And probably the two we think most about are tick-borne diseases, Rocky Mountain spotted fever or Lyme disease. I'm not going to talk about them today because I do want to talk about one other one, and that's toxoplasmosis. Toxoplasmosis is a parasite. Unfortunately, if a woman is infected with toxoplasmosis either right before or during pregnancy, it can cause significant consequences for the fetus. The transmission rate, it goes from the mom transplacentally into the baby, and it causes a triad of chorioretinitis, infection in the eye, hydrocephalus, blocked drainage from the brain, intracranial calcifications. Often infants born with toxoplasmosis have no obvious signs initially, but they develop the signs later in life. It's very important, CDC stresses, for a pregnant woman, avoid changing cat litter if at all possible. If no one else can perform the task, then wear disposable gloves and wash your hands with soap and water afterwards. Be sure the cat litter box is changed every day. The parasite doesn't become infectious for 1 to 5 days after it is shed. Feed your cat commercial dry or canned food, not raw or undercooked food. Keep your cats indoors. Avoid stray cats, especially kittens. Do not get a new pet if you're pregnant. Keep outdoor sandboxes covered and wear gloves when gardening. Also, as with so many things, it's really important that you handle food properly, cook meat appropriately. Don't eat raw or undercooked meats. Avoid soft cheeses and so on. So how do you stay healthy around pets? Always wash your hands after handling pets. Don't rush to get a new pet. Children under 5 and those over 65 and anyone with an immune system should not have contacts with rodents, reptiles, amphibians, and poultry. Don't kiss, snuggle, or hold these same animals close to your face. Always supervise children around pets. Don't let them kiss their pets, hold pets close to their face, or allow them to lick their face or mouth. And try to keep your pet supplies out of the kitchen and other places where you prepare food. They recommend cleaning up after your animals. Always remove dog waste from public and private spaces, even though it's a bit unpleasant for you. It makes things much better for other people. Clean cages, habitats, supplies outside the home when possible. Whatever you do, make sure you wash your hands very well afterwards. Avoid rough play with animals. Teach children to be aware of, but not overly afraid of animals. And as we talked about before, clean wounds quickly. And don't get wild animals as pets, and especially don't get poisonous snakes as pets, but that's another story. In terms of the economic risks, often people get a pet without realizing how much it's going to cost. This estimate says $20,000 to $55,000 for dogs and $15,000 to $45,000 for cats lifetime cost. You'll see some of the dog estimates as low as $14,000 or $15,000, all the way up to $100,000. But the idea is a lot of people get a pet without really thinking about whether they're going to have the money and whether that will impact them in other ways. And finally, societal risks. This is something we don't think about a lot. But sometimes people suffer health consequences because they're unwilling to abandon their pet. Homeless people often will not come in to a shelter, even if it's very, very cold at night, because the shelter won't accept their animals. Domestic abuse victims, a third of them have delayed leaving an abusive situation out of concern for their pets. And then people asked to evacuate during disasters. 44% of the people in Katrina who did not evacuate said they didn't do it because of concern for their pets. Now, I understand there's always a balance between human life and pets, but a lot of places could work out ways of having pets in there. So if you're in the business of helping these people, homeless people, domestic abuse victims, disaster people, thank you for what you do. You save many, many lives. But please explore ways that they can bring their pets with them, because if someone won't come in off the street, even when it's sub-zero, because of concern for their pet, they're going to suffer. Their pet's going to suffer. If there's any way you can help them, please do so. So should I have a pet? Well, I'm biased, of course, but for tens of thousands of years, 20, 30, maybe 40,000 years, people have had dogs, and almost as long have had cats. Clearly, they're part of who we are as a species. I think at the end of the day, having a pet, if you can afford it, if you're relatively healthy and you can take care of the animal and give them the love and affection that they need, is a great thing. I think it's good for our health. I think it's good for their health. So please feel free to share this video with anyone who might be interested. I'd like to thank Dara Young for editing, producing, adding captions, and posting this video. And as always, if you have any questions about what I've said, or would like me to cover any other topics, please let me know. I look forward to hearing from you. And until next week, please be well.